This is an 8 or 9-year-old. Mom reports teeth grinding, mouth breathing. He has a high palate. So looking at him, we see his lower jaw rolling back, a little bit tight muscles, closing those lips. He's got to work to close those lips. He has a flat upper lip, mid-face deficiency, gummy smile, upper jaw's going down instead of forward. Ideally, we want to see more of that upper lip here. If these jaws are going forward, we want to have him easier time closing his lip if the jaws are in a forward growth pattern. A little bit of bags under his eyes, crowding on the bottom, crowding on the top. His upper teeth did not have room to erupt. They were crowded up in the bone, so they came out in the wrong position. We want to develop this jaw forward. He has wear on his canines. Big overbite, lower jaw trapped back. The lower jaw is pretty far back in this mouth. We see his upper jaw kind of coming down, getting him in an appliance that's going to get this upper jaw up and forward and unlock and help his lower jaw forward. Is going to help his airway. He has some width here, but we want to get things going forward more, and getting him forward will help get the back of the tongue forward off the back of the throat to really help his airway. Here's his width. So this is at a 43 from the cusp tip. His inner molar at the gum line margin is probably somewhere around a 37, give or take. So he could use a little more width for these front teeth. His permanent canines are going to be even bigger. He's going to need more space. He needs some width here, but we also want to help get him forward to make room for his second molars. It'd be nice if we make room for his wisdom teeth. I don't know if that'll happen, but certainly we can work towards it. Mom reports teeth grinding, drooling on the pillow, being hyperactive, which is a sign of possible restless sleep and sleep deprivation from not getting quality sleep cycles. He has mild sleep apnea. 5 times an hour, every hour, he's in respiratory disturbance. 1 time of those lasts anywhere from 11 seconds to 38 seconds for a breathing disruption. So 5 times an hour, that's about every 12 minutes. And that's enough to disrupt his sleep cycles. Looking down here, we see a lot of up and down. He's got some good stable sleep, but his REM, when his muscles relax, is not as stable. So he's bouncing out of that REM, which is really the restorative, rejuvenating sleep cycle. He has his permanent 6-year molars in, so that's going to be a mixed dentition, Tanner Airway Appliance. He almost has room for his front teeth, not quite. We could go lingual if we want to make room, or we could go distal. In this case, I would probably go distal on the canines because he really doesn't have a lot of crowding. After we get him forward and up a bit, we could cut off those canine caps and make it lingual on the canines to give a little more room. So right now, he really doesn't show a lot of crowding, although he does have some. He's got some good width, so I would go ridge. And I would give him slight more width, but mostly going forward. If he had an inner molar of, 44 to 46, then I would go straight. Certainly, if we did another appliance in the future on this child, we could go straight. If he had a lot of crowding in the front, we would do widening on this. I think he's at a point where ridge would be good. It's going to give him mostly forward and maybe just a little bit of extra width, which would be a good thing for him. Vertical angulation, because he has more of a deep bite, I might do 10 or 15 degrees for him. If he was older and closer to losing all of his baby molars, I might be a little more aggressive on this and do 20 or 25 degrees. But because he's younger, 8 years old, we can go a little slower with this and be a little more gradual. So 10 or 15 degrees there. Occlusal coverage 2, incisal 4, palatal 4. That's going to help us lift this up. He can choose a color, case color, and then we'll have a bent key with that. Again, the front acrylic 2 millimeters is a little easier to adjust to. If they ever break an appliance, I recommend doing 3 to make it a little stronger. If it does crack in the front, we can repair that with acrylic. The wire's in there. It will not come apart. We can repair it and add thicker acrylic and still keep them in the same appliance. On the lower, we could do a Schwarz or a Richardson, either one. He has a little bit of overlap between those incisors. I would keep it to a Schwarz, open that up, give him a little more width. And along with the ridge on the upper, it's going to give him a little more width on that upper so the bite can match up and we can give space for all of those teeth.